bottom now. What have you been experiencing in the bottom of your feet? Any pain, any discomfort or anything? Numbness, tingling?
Yeah.
What have you been experiencing?
It's been like pain
Mm-hmm.
and be numb.
How long would you say that's been going on?
For the last couple of years.
Okay. More than likely directly related to your diabetes.
Yeah, I know.
So you said you last took medication for your diabetes was a couple of months ago?
Yeah.
Okay. Let's see. You look like you got some good veins in your arms. Look like we're going to be able to do a full profile today.
Okay, good.
For the blood work. Let's see where you are. All right?
Okay.
So what we're looking at is for the shelter down at 2nd and D. So Alexa's calling them now. My medical assistant.
Mm-hmm.
She's calling them now to get you set up to go to the clinic down there in between seeing me.
Okay.
Because the dressing for your big toe on your right foot
Mm-hmm.
has to be changed daily.
Okay.
And if you're not in a good position to do it in a nice, clean environment, then you should have them do it there at the clinic rather than doing it on the street. You know what I mean?
Okay.
That means they're at high risk of getting an infection. And an infected wound like that can really become a problem. Put you at a high risk of losing the toe. We don't want that to happen, right?
Right.
So I'm very aggressive on these things.
Because my sister half a leg, two toes.
Oh, yeah? Do you have a regular pharmacy that you use?
Yeah, Safeway on Georgia Avenue.
The one down the street here?
No one at Petworth.
Petworth? Okay. There's a lotion I'm going to prescribe for you.
Okay.
As well as an antifungal cream for the bottom of your feet.
Okay.
Is this itch at all? A lot of dryness.
I know.
Yeah, this is mostly dry skin, which makes it easier to deal with. How are you doing up there?
I'm doing good. It's amazing, like all this dead skin, like.
Yes, ma'am. I mean, you haven't had this done in a long time, right?
Right, but I'm just saying it's the excessive overlay of skin and overlay. I mean, just my body in general.
Yeah. Well, since you don't use the shelters much, what do you do to bathe and stuff like that? How do you handle that?
Now I got a membership to Planet Fitness. So
Planet Fitness? Okay.
The one right there, yeah.
So you use the shower at the gym?
Yeah, just started doing that.
Okay.
I ain't even took my first shower yet.
Okay. Do they give you a hard time when you go in there?
No, because I have a membership.
Okay.
For the one, because through my insurance, America, if I got a lot of
Mm-hmm.
benefits, I'm entitled to, yeah.
Okay. See how we're doing here now. Make sure there's nothing hiding under here like it was under your big toe. Yep.
Just letting you know your daughter called.
My daughter or her daughter?
No, your daughter. Oh, yeah.
Did she say what she needed?
No, she just said to let you know that she called.
Okay, I'll call her back. Hey,
What's up?
did you get in touch with Second and D?
They're on lunch. I have to call back.
They're
at
at
1.
lunch. Like
The
everybody?
Like the office is closed from 12 to 1. They just go straight to voicemail.
Okay, all right.
So I don't want to leave a voicemail. I'd rather speak to somebody and I can speak to somebody at 1.
Okay. Okay, this is okay.
Okay.
All right. There's no wound under here, which is what I was most concerned about. That's not the case. That's good. Always a big concern in these cases. Yeah, it's a lot. Sorry for tickles. Almost. Gotta get all this dead skin off. Sorry, my friend. I know it tickles. You're doing very well. There we go. Tickle torture is over. Alright, so what I'm doing now is cleaning between the toes.
Okay.
You have to make sure after you bathe that you dry between the toes completely.
Okay.
Alright? So you don't all that dead skin and stuff you have between the toes.
Right.
That's how you gotta get rid of that. You wanna make sure it stays dry.
Okay.
A little shea butter mix on here now.
Okay.
Moisturize. Because dry skin in the feet of a diabetic is bad news. It causes cracking of the skin and things that we've already started to get.
Yeah.
Especially in the feet, it's a problem. Okay?
Okay.
So you're going to need to moisturize every day.
Okay.
From the lotion I'm going to prescribe to you.
Okay.
Alright, now, hopefully the clinic that I want you to go to, down at the shelter downtown, they can start seeing you immediately.
Okay.
So you can start getting the dressing changed on your right big toe on a daily basis. And you're going to come back and see me every week.
Okay.
Until it's healed.
Okay.
How long that's going to take? Can't tell you. Alright? These things don't have a timetable.
Yeah, I bruise easy, not on the heel problem.
There we go. This is what I like to see, my friend. Immediate improvement. Cleaned up. And you put the medicine on it. Alright. Gauze. And wrap it up. Every day. This has to be done every day.
Okay.
It needs to stay covered at all times.
Okay.
None of that leave it out to get air stuff.
Okay.
Alright? I don't care what your grandmama said.
How long does that stay covered for?
Until it's healed up.
Okay.
I'll let you know when you don't need to cover it anymore.
Okay.
There we go. That's good. Now, last thing is where'd it go? Oh. The last thing is this. This is a spray. Powder.
Okay.
I'm giving you this.
Okay.
This was sent to me, but I'm giving you this. Okay? You gotta spray between your toes.
Okay.
Every day after you bathe.
Okay.
It's gonna help keep it clean, keep it dry between your toes.
Okay.
So you take this along with the other stuff.
Okay.
There we go. This is yours.
Okay.
Okay? I just get all this stuff out the way. Just because I want to measure your feet. Make sure you got the right shoe size. Okay?
Alright.
Alright, so your longest toe is actually your second toe, not your big toe.
Right.
So lift your left foot up. Okay? Okay, lift up. Yep, you're wearing the right size. Excellent. Alright, so just make sure they're not too tight.
Right.
Okay?
Now I finally got something that's the right size.
Alright, well you can go ahead and put your socks and boots back on.
Okay.
We're going to see you up front and get everything taken care of.
Alright.
See you next week. This is Kevin Jefferson, the DC Foot Doctor. Thank you very much for watching this video. Like it with a big thumbs up and subscribe to the channel. Ring the bell so you will know when a new video has been uploaded. Share it with your family and friends. If you leave a comment or a question, it may be featured in a future video. But most importantly, take care of your feet.